In the United States, there are many sexually transmitted infections, but human papillomavirus is one of the most common. Approximately 70% of sexually active people acquire HPV at some point in their lives. In many individuals, HPV can clear spontaneously within 3 years. However, repeated exposure to the virus can increase the risk of cancer. According to the National Cancer Institute of the United States, human papillomavirus is actually a group of viruses with more than 200 related viruses. These viruses are categorized into high-risk and low-risk types. There are 12 types of high-risk viruses, of which HPV types 16 and 18 are responsible for causing most HPV-related cancers. Low-risk types can also lead to cancer if not treated, but this is rare. HPV can cause several types of cancer, including cervical, anal, oral, penile, vaginal, and vulvar cancers. Every year, about 350,000 women die from cervical cancer worldwide. How does the HPV spread? Human papillomavirus spreads between sexual partners through penile to vaginal sex, penile to anal sex, vaginal to oral sex, or penile to oral sex. Low-risk HPV may cause warts around the genital areas, anus, throat, or mouth, while high-risk HPV is a dangerous infection because it doesn't show any signs or symptoms for many years. It depends on the location of the infection. According to the World Health Organization, it usually takes 15 to 20 years for cervical cancer to develop after HPV infection. Symptoms of cervical cancer may include bleeding between menstrual periods, bleeding after sexual intercourse, and foul-smelling vaginal discharge. However, other factors may also lead to these symptoms. The first and most effective preventive measure against HPV is vaccination. All girls between 9 and 14 years of age should receive the HPV vaccine before becoming sexually active. The second preventive measure is screening. Women older than 30 years should be screened every 5 to 10 years. And the third most important measure is protection. Use of condoms is recommended for the prevention of HPV, but it does not always ensure the prevention of transmission. Male circumcision also reduces the risk of virus transmission. Currently, there is no specific treatment available for the HPV infection itself. However, HPV-related cancers can be treated. For cervical cancer, early detection is the most important factor for successful treatment. Non-malignant and precancerous warts and lesions can be removed surgically or treated by ablation therapy. Recognizing the global burden of cervical cancer caused by HPV, the World Health Organization has adopted a global strategy to eliminate cervical cancer as a public health problem. The strategy sets ambitious targets that 90% of girls should be fully vaccinated against HPV by age 15. 70% of women should be screened with a high-performance test by age of 35 and again by 45. And 90% of women identified with cervical disease should receive treatment. Prevention of HPV-associated precancer and cancer is also a key element of World Health Organization's Global Health Sector Strategy on HIV, hepatitis, and sexually transmitted infections for 2022 to 2030. These global initiatives reinforce the importance of vaccination, screening, and early treatment in reducing HPV-related disease and deaths worldwide.